Thank you, Kate, and thank you, Linda. So we are really thinking about what it means to end veteran homelessness, and we get a lot of questions about what that definition is. Is there a clear definition? You can go to the next slide, please. So we have had at the Alliance here, we have had the privilege to work with FSVF grantees all over the country for the past year and really get a sense for what is working well and what communities really need. And as Linda said, really see the communities that are the communities that are working towards ending homelessness and what really is working there. And we often get this question, what does ending veteran homelessness mean? And so we thought we would talk a little bit about that for a minute. So ending homelessness means there's no veteran in your community that's ever forced to live on the street. There are no unsheltered veterans. And when homelessness does occur for a veteran, it is rare and it is brief, because we know that homelessness will occur again. But we will have hopefully optimized our system so that it is rare and brief. And homeless veterans are quickly housed and few return to homelessness. And if a veteran is about to become homeless, prevention resources are available. Next slide, please. So where do we start? Linda touched on a lot of great strategies and ways to things to implement in your community. And chances are your community has already gotten started with this process, either with your COC, your SSVF or BASH providers, maybe you have 25 cities or the Mayor's Challenge. Well, some of you may not have a veteran-specific initiative focused on ending veteran homelessness yet. So you want to know where to start. Either way, the strategies we will be sharing throughout this webinar series will be ones that you can start implementing right away, no matter what type of community you are. These strategies are for places that have either reached their goal of ending veteran homelessness, like New Orleans, or are getting close and making great strides to get there by the end of this year. And we will just talk about a couple of them. Next slide, please. So building on all the great strategies we just heard about, we're now going to focus on a couple of different strategies that are critical to get your community started or push them in the right direction if they already have initiatives underway. So we're going to talk about identifying and coordinating with all the necessary partners and stakeholders to begin meeting a lot, and also talk a bit more about creating that master list of names. So why identify and coordinate with partners? You probably know the answer to this, but one program or agency cannot end veteran homelessness alone. Many programs around the country are trying. They have a lot of maybe SSVS funds or they have BASH, but it is pretty impossible to do it by yourself as one program. So you need all the partners you can get to overcome the myriad of challenges that are involved and come up almost every day. You might have a couple of different groups or just one, whatever makes the most sense for your community. You don't want to create a ton of new groups, but if you already have a vehicle for this type of activity that already exists, you could use that. But a primary planning or oversight group should oversee the process and involve people, and this is important, who can make decisions for their agencies, from Homeless Service Providers Network, the VA and VA-funded providers, SSVF and BASH, your housing authority, other major funding partners. It's important that these people can make decisions because they are probably going to have to make changes in their own agencies. So this group might be enough, or you may want to also have a group that has more frontline staff that are working with veterans every day to work through some of the day-to-day kinks. Either way, the coordination piece with other partners is key. Even these aren't the partners who you've been able to work with in the past, and traditionally have not had certain folks around the table. And our next panelist will talk a little bit more about what it means to really work with your partners. And one tip we've gotten from New Orleans is that you really might want to also get someone with authority or some sort of special clout to convene these weekly or biweekly meetings. For example, your mayor could appoint staff like in New Orleans, and that person can really drive the process and sort of really help make change happen. So yes, we're recommending that you're meeting every week, which I know sounds like a lot when you have so many other meetings. But these tips are coming from places that have figured out how much work really needs to go into working through all of the kinks, streamlining processes, programmatic changes, the ways to make things more efficient and effective. So meeting a lot is sort of required. And you might start off meeting a little bit less often, and I've seen communities realize they just need to meet more to kind of work through the deadline, because it's we only have 8 months and there's a lot to do before then. So you also just don't want to meet, right? So you want to make your meetings as productive as possible. And so these are the kinds of activities that you probably want to have at these meetings. You're going to want to use the master list to determine veterans' housing needs, barriers, and next steps. You're really going to be working off that list, which is why it's so important. You're going to want to identify changes that need to happen at the agency and system level and really make those changes. You're going to establish common goals and targets, as Linda touched on. How many veterans are we going to house each week, each month, and this year? How is everyone going to be on the same page about that? Who's going to be accountable? You're also going to have to really be willing to change how you do things at your program. It might mean changing your intake processes. It might mean changing your outreach or moving around staff to co-locate at other locations. But you should come to the table willing to change how you do things. Most importantly, setting deadlines, benchmarks, and targets, and tracking all partners' progress toward this goal makes everyone accountable and really helps you celebrate your success and identify where things aren't working so well. So this is a very important piece. Now we're going to talk a little bit more about credentials. And as Linda emphasized, you cannot end veteran homelessness unless you are intensely focused on those who will otherwise show up as living on the streets or in a homeless shelter in your 2016 point-in-time count. So PIT numbers and gaps analysis numbers are always helpful, but having a master list of names is best. So why do you need a master list? I think at this point you probably have a fairly good understanding of that. But creating a master list of veterans known to be homeless and continuously updating those lists ensures that all providers and partners are on the same page and have a clear set of people, not numbers, that need housing. So this is why, a lot of people are getting confused about the different numbers they're getting, whether it's the COC gaps analysis or their PIT numbers or their HMIS numbers, but having a list of names really reduces this confusion and duplication. Facilitating communication between the local VA and continuum of care is important, and this really helps in the identification of veterans that may be ineligible for VA services. So if you have SSVS and VASH in your community, that's great, but there are veterans who are ineligible, and we need to work with the COC and other COC programs to make sure that we have a path for those veterans to housing. A list really enables all partners, including the COC and the VA, to quickly find and house all homeless veterans as soon as the housing opportunity becomes available, right? So you're working together with your partners. You have actual names, so you can really figure out how to get people into housing as quickly as you can. So identifying all homeless veterans in your community is a place to start, and it doesn't have to be a perfect list. The key is to get it started. So in identifying all homeless veterans in your community, there's a lot of ways to do this, and there's not really a perfect way to get to that list. So you can do a registry week, as Linda suggested, and that's some place that a lot of communities have started. Another way to start with is those you identified in your 2014 or 2015 point-in-time counts. 2015 is definitely better, but you might not have those numbers just yet, so I know that those are coming this month. If you didn't capture enough information to identify veterans in your point-in-time count, you can start with HMIS. And you can start with either one of these and use the other source to build your list. And I know getting a report out of HMIS can be really complicated, and you may have to work with your HMIS administrator and your COC to back into it. But there really isn't a canned report usually, or an easy way to pull all the veterans from the system. And one community I spoke with in Florida actually started by making a list of all HMIS entries going back about 3 years to anyone who said that they were a veteran. And that got them a list of 1,000 names, right? So that's way more veterans than they actually have. So they had to work with the list to get it to a place where it had maybe 400 or 500 real names of people currently not in housing and still in need of services in the community. Confidentiality questions may come up, but you really can work with your HMIS administrator and partnering agents to get around a lot of these issues. So if confidentiality it becomes a barrier, that's usually due to either misconception or misinformation or something that can be easily changed in an RLI or in some sort of regulations around the community. If you have an open HMIS, you should be able to share this data. It takes time to clean the list, but it is a great place to start here. So beyond HMI and your PIT data, you can also start or build your list by having every program and outreach worker give you a list of names. It's sort of obvious but simple. You want to contact every shelter and transitional housing program in your community that may have veterans. And sometimes that can be challenging. There are programs that may not want to give you the list of veterans they have or not give you names. So that is kind of a piece where you will have to relationship build a little bit and try to get that list. You're going to work with your local homeless outreach team to find these as many unsheltered veterans as you can, and really work with local VA healthcare programs and outreach teams. And you want to ask shelters to flag veterans immediately and set up a protocol so the veteran is immediately connected with the appropriate program, such as SSCF or BASH. And that hopefully is happening through a coordinated entry system, but if that isn't being set up, you just want to have some kind of clear path to get to veterans as quickly as possible. And you want to make sure you're finding every veteran who's not in your network or hasn't been coming in for services. So next, you want to begin to create a shareable master list and start working it immediately. So what does that mean? You mean it's okay if it's not complete. You're not going to feel like it's complete. It's sort of a changing living document. So start with however many names of veterans you have now and continue to build this list as you find more homeless veterans. And share the list at your veteran-focused regular meetings with partners, because all partners should start working the list together. You should have everyone on the table that you need to figure out how to house these folks and what programs they need to go to, what barriers they're facing, who can remove those barriers, how can you make this path to housing more efficient. There are lots of processes. When you come together, there's a lot of processes that you realize are maybe unnecessary, a lot of different points where the veteran has to maybe, do a new form or a new intake, and there's ways when you sit all together that you can see where there's ways to create efficiencies, ways to make this a process that is much more navigable for the veteran and makes them able to get housing much more quickly. So very importantly, you need to manage and update your list as regularly as possible, because this is not a static list, as I said. It should be changing daily as people get housed or added to the list. So for example, your starting list may have names that are no longer in need of services. You might need to scrub the list of people who should no longer be on it, and that can be a very time-consuming process. So you want to remove those that are already housed, for example, or those who can't be contacted. But that's an ongoing process. You don't have to wait to get your list to be clean to get started. And most importantly, you want to find every veteran, as I said before, and keep building the list. Update your master list every day, if you can, with the names of those newly founded emergency shelter, and make a concerted effort to outreach to unsheltered veterans, or even folks that might take several contacts to give you a name. You really want to work with your outreach team to figure out how to best do that. And if your community doesn't have a professional outreach team able to do this, you can organize one or two veteran-specific outreach people. In some communities, they have just staffed their veteran outreach with people who do their point-in-time count, or they've gotten help from the VA or from off-duty military personnel. There's a lot of different ways, but the outreach piece is really, really important, because you want to make sure that you're capturing every veteran in your community, no matter what what their discharge status is, where they are. You want to make sure that they're on that list.